miss. So I'm Colleen Cuff. I am the program manager over Medi-Cal for Placer County. And I'll talk to you a little bit today about what's really happening with the unwinding as everybody's hearing about and concerned. And then we have Ryan here.
Yes, I'm Ryan Frudnick. I'm a program manager in Placer County Health and Human Services Division as well. And my expertise is in CalFresh, and I'll be talking a little bit about the impacts to CalFresh. So I think we'll get started. Looks like folks are rolling in. If you move to the next slide, Katie. Thank you. So as Colleen mentioned, we're here today to talk a little bit about the public health emergency unwinding and its impacts on CalFresh and Medi-Cal. Back in March of 2020, the Families First Coronavirus Response Act was passed into law, and that provided some flexibilities in our programs to ensure the most marginalized and vulnerable communities would be helped with the impacts of the pandemic. It's definitely been helpful for sure. The major areas of help that we'll be talking about mostly today are the emergency allotments in CalFresh, which raised everybody's benefit allotment to the maximum at a minimum of $95 a month, and flexibilities in Medi-Cal to ensure that individuals had no negative actions taken. In other words, their medical benefits were not cut during the pandemic. So these were obviously very impactful and very helpful for our populations in Placer throughout California and across the country. So next slide. In Placer, we have over 40,000 households that are receiving Medi-Cal and over almost 13,000 households enrolled in CalFresh. These are much larger population bases than we've had in the past, really demonstrate the need that is out there. We also believe there are more households to be enrolled that are not receiving our services. So we're always looking to ensure that those that are in our community are getting the help that they need. In total, there are over 45,000 households that are receiving one or both programs. So you can see that's very impactful in our county, the services these programs are providing. Next slide. So with the unwinding of the public health emergency, the emergency allotments are going away. They were slated to be ended in the Consolidated Appropriations Act of 2023 that was passed back in December of 2022. And it very specifically outlined that EA benefits could not continue regardless of the end date of the public health emergency. So what that means is that we're going to see EA benefits end effective, they ended effective February 28th. And so the last month for EA benefits is February of 2023. They will be issued on March 26th. Those benefits always came 1 month after their approval date for the month benefits. So households and families will still receive those benefits on March 26th, and any missed issuances. So if you hear from any customers that didn't receive that were on benefits in February of 2023, there will be makeup benefits in April and May, trying to catch any of those missed issuances. Obviously, regular benefits will continue. However, with the ending of the emergency allotments, the amount folks are otherwise eligible to will be their regular benefit payments moving forward. And as you can see on the slide, the average of about $182 per household was very significant for our households, meaning they're going to expect to see quite a reduction in benefits, unfortunately. Next slide. So with that, for those that are really aware of the impact of CalFresh, CalFresh not only helps our families and individuals that are in need, it also really helps the local economy. The government office, estimates that total federally at about $1.79 per dollar of CalFresh benefits brought into the state. So that economic impact helps a lot of local businesses, particularly grocers, restaurants, and ag industry. But it has a ripple effect when cash is available to households when they're receiving these food benefits to spend in other areas as well. So it really has a pretty significant impact to our county. Our households have been notified. There were several, there was a text messaging campaign, a call campaign, notices went out to all households. We've been posting on our websites. I know for a lot of our community partners, we've asked you to post as well. And so we've done everything we can to get the word out there. But obviously, households still may not understand. And there's some important things to understand in relation to the loss of these benefits. One of those items is that, they probably need to reach out to us because we may be able to reassess their eligibility. There may be circumstances that have changed that, due to the reporting structure in CalFresh, which is semi-annual reporting, they can voluntarily reach out outside of their required touch points with us to review eligibility. And we may be able to determine that their circumstances have changed, which may result in additional benefits. So there is a good reason to check in with us if they're concerned. Obviously, they are not precluded from seeking food from food closets or food pantries at this time as well. And we always encourage them to reach out to other organizations and resources in the county whenever we get chances to speak to our customer base and advise them beyond just the programs that we offer. It's also important for the community to understand there really is no recourse when it comes to the loss of these benefits. This is a federal law change. The benefit structure is set federally. There are some state options. California takes most of the state options that help customers out, but really no administrative law judge, nor can the county, nor can the state of California provide these benefits again. And that's the hard truth, but definitely want folks to understand that as well. As frustrating as that is, there really isn't a solution to that problem. If they do have questions about the change, they can reach out to a state call center. That number is on the screen here. It's 888-445-1955 for additional information about the change. And again, they can always reach out to Placer County Human Services as well. Again, especially if we can review their eligibility and determine that they may be eligible to more benefits than their allotments now with the loss of the emergency allotments. And with that, we'll have time for questions at the end. I'm going to turn it over to Colleen for Medi-Cal.
Okay, so Medi-Cal, and I think everybody's been hearing a lot about the continuous coverage coming to an end. And as Ryan stated, it was in December of 2022 that the omnibus bill for this year was signed, and they took out the continuous coverage provision from the public health emergency. They were no longer together. So even though the public health emergency ends May 11th, the continuous coverage ends on March 31st. But what does that actually mean? That means we do start to resume renewals for June. So how Medi-Cal works is that we start working on renewals about 75 days before they're actually due. So when we start on April 1st, we actually started last week. We gave the staff received their lists of renewals for June. And what we do with that is we review all the renewals that we get, and we look to see which ones are eligible to be automatically renewed for the following year. So the actual discontinuances that will not occur until July 1st, which is great news, right? So how we've been preparing for this is our staff have not discontinued working on renewals, right? There are some counties that haven't done any renewals at all. But our county, we've gone through the process every single month since March of 2020. working on renewals, ones that we could create positive changes for, ones that moved out of state, requested to be discontinued, adding people to their case. So they got these lists since March. We have been doing the process. So that's a good thing. We've also reached out, as Ryan stated, to our community partners. We've asked them to get the word out, because the biggest reason people are discontinued for any of our programs, including Medi-Cal, would be that we don't have current contact information for them, right? They've moved, especially in 3.5 years. By the time we're doing June renewals, it's 3.5 years, because we backdated to January of 2020 when we stopped taking negative actions. So we may not know that they moved. We may not know their household composition. We may not know their current income situation. So again, they could still be eligible to Medi-Cal. They just need to reach out to us and let us know those changes. So we have messaging on our IVR system. We have messaging on our website, forward facing to the customer. We've created outreach with our CBOs and our MCPs, those are managed care plans. They are actually just recently started to send us lists of customers that they know of. That would be Anthem, Blue Cross, and California Wellness. And also Kaiser has some of our beneficiaries, and they're giving us lists of updated information, and we're working on those, trying to get everything updated before somebody's renewal is due. And so there's a concerted effort out there to make sure that people are aware. DHCS has sent out phase 1 and already phase 2, which are notices. They have flyers and all the renewal packets to make sure people are aware. So what customers will receive going forward, they're either going to receive a notice of action that states that we have already approved their Medi-Cal for the following year, or they're going to receive a renewal packet. And that renewal packet is going to be flagged with a yellow envelope. So there'll be no mistaking that the renewal is in the packet, and that we obviously need something from them, right? So they won't receive it unless we were unable to move it forward to the next year. So there's a couple different things happening with some protected groups of people. We have an expansion going in 1/1 of 24 for 26 to 49-year-olds that weren't usually eligible to Medi-Cal unless they had some kind of linkage. And so regardless of immigration status, they will be eligible to Medi-Cal if they meet all the other criteria. But instead of discontinuing that group of people now, they're going to automatically roll them to January through June of 2024 to not work their cases until then. And then just recently this week, DHCS asked CMS for another waiver, and that is on the asset test that we do impose on our non-MAGI cases, which are generally speaking our long-term care beneficiaries. So that asset test also goes away 1/1 of 24. So even though the waiver hasn't been approved yet, they have requested that we can look at older information to move their case forward and not work the ABB test that comes back. So we are trying very hard to make sure that people that have Medi-Cal remain on Medi-Cal. There are going to be individuals that maybe they are incomed out over this last 3.5 years. And then there's about a 30-day period after somebody's discontinued that Cover California has a system now. They're supposed to be reaching out to them to see if they're eligible to any other, program that they could still get some help with on their share of cost or any of those things. So I just got some information today, some stats I looked at today, which were great, because I was looking to see, who was turning the packets back in, even though we weren't taking negative action when the packet came back. We reviewed the packet for a positive change or a no change, but not for a negative change. If there was one, we just didn't work it. But for an idea, we had 1,901 packets that went out in December, but we got 1,843 back. That's a great percentage. And we had 1,821 out in January, and we got 1,758 back. And so those are, I was surprised at those stats with the public knowing that no negative action was being taken. So that gives me a good idea that we have a good communication plan out there. We're reaching the community. They're hearing about it, and they're still updating with information, which is great to see. I don't have the numbers for February and March. They're too new to get those figures yet, but those are great numbers to see. So we also got figures back that 45% of our eligible cases to auto roll are rolling, which is much higher than we anticipated. We have a brand new state system, which has been a challenge for all of our programs to get to know. We had a much better rate with our old system, but it took a long time to get there, and it'll take a long time with CalSAWS as well. Hopefully not too long, but we dropped a little bit, but not as much as I thought we had. So that's good news too. Placer County's in a good position. The staff is ready. They've done their refresher trainings. We do have a lot of new staff. As I think everybody knows across the country, if not just California, that staffing is an issue and keeping employees is an issue. So we have a lot of new staff, and they perhaps haven't done the volume of work with Medi-Cal renewals that some of our more seasoned staff have done. But we have been getting them ready and prepping, and we feel that we're prepared as much as we can be. Like I said, they already have their June list. They're working them as we speak. And we'll know about mid-April about how many of those cases really initiated a packet to be sent out. And then when those packets come back, we'll work them as fast as we can and get ready for July. This is a great website too that you can refer your anybody you ask. There's a lot of information on this website applying for our benefits, what each program kind of entails, and it's a good community website there.
And additional resources for customers and links to referrals there. So like Colleen said, really, really helpful.
The 888 number is our call center here. So this timeline just kind of reiterates what I've said. April 1st simply means we're prepping June renewals. The April and May renewals, people who have renewals due next month and the month after, those are still protected by the continuous coverage. So our first renewals that we are working are April 2023. And then we go through next year, May of 2024. Thank you.
Sorry, I may have missed it. I had to take a call, but I saw that you said that we're no longer auto re-enrolling as of April 2023, but we still need to look out for if we get a renewal form or we don't, and then we don't need to refill it out.
So I'm not sure on the first part of your question. We're not we're always, there are certain cases that will always auto renew on their always. So there's different kinds of Medi-Cal cases, and only certain ones are eligible for auto renew, and it's about 80% of the total cases, and then about 45% of those will automatically roll to the next year, and the customer will simply receive an approval notification that their Medi-Cal was approved for the next year. If they don't get that letter, they should get a yellow envelope with a packet enclosed of what information they need to get back to us by the date on the letter inside.
Okay, thank you.
You're welcome.
I just have a quick question. You mentioned something about 26-year-olds starting in January. Gave us an age range for people regarding of their status, immigration status. Would you mind repeating that just so that I make sure that I have the right info?
So January 1st of 2024, the age group 26 through 49, regardless of immigration status, can be eligible to Medi-Cal as long as they meet all other criteria.
Where can we find that criteria?
Well, it's going to be, income primarily for Magi, and it's going to be, it won't even be resources once one hits. Before, people had to have a linkage to Medi-Cal, children or some link to it. It's pretty involved to go into all the eligibility criteria because there's so much, but way back before Affordable Care Act went in, right? It kind of stopped at age 18 and now it's extended to age 25. And we had adult expansion for 50 and over that went in last year. And so 50 and over, regardless of immigration status. So we got about 1,000 more people on Medi-Cal because of that in Placer County. And now we're just basically what we're doing is no matter the age, right? Because it used to be age specific. So now from 0 to when they're eligible for Medicaid at 65, they're eligible regardless of immigration status, provided they meet all of the criteria for whatever Medi-Cal program they're eligible to.
Okay, and that will be starting January 1st.
Right,
next year.
Of 2024.
Okay, perfect. Thank you so much for that clarification.
You're welcome.
Any other questions? You can use the chat as well if you don't want to speak, but anybody else?
One last question, so sorry. And so what happens at this moment with people that are in this kind of age range, the 26 to 49, and they have no, they don't have a legal status here. We've had some clients come in that are wanting to, complete paperwork for Medi-Cal. And our understanding was that they wouldn't qualify based on their status. There needed to be a social security number. And do we just continue to do applications for them as they still will qualify for emergency Medi-Cal? Is emergency Medi-Cal going to disappear, or?
No, they would still be eligible for a restricted Medi-Cal. Anybody from April 1st on won't be in that protected situation. So anybody that is 26 to 49 right now, regardless of immigration status, so they don't need a social security number.
Mm-hmm.
They'll be protected. They're going to move those cases. So if they're active right now, DHCS is going to move them to January of 2024 and try to evenly distribute that between January and June, depending on the number per county. Anybody who applies from April 1st on will still be subject to those conditions and be eligible, though, to the restricted scope. Yes.
Thank you.
And I did want to take a moment too to mention that for, our families out there with school-age children, we're always encouraging them to make sure they're signed up for National School Lunch Program, and that they're also signed up for the summer program. I think there's one more round of pandemic EBT as well that's slated. I don't have the specific dates or information in front of me, but I think that will be the last round of that as well. So there are, like I said, other resources out there, and if you have any questions, you can always reach out to myself or Christy Simpkins. I know a lot of you are active in our food network, and we certainly will be kicking out more information through there and through our website as well. So more information will be provided for additional resources. And if there are no additional questions, thank you all so much for your time today. And please do not hesitate to reach out if you have more questions.